So thousands of people have been displaced by fires across the country, with many struggling to cope with the crisis. There is a new program that is helping those struggle with their mental health, just the stress of it all. They're receiving daily supportive text messages. It's something already being done in Alberta. And joining me now to discuss this is Dr. Vincent Agyapong, professor of psychiatry and global mental health at Dalhousie University. Good morning. So glad you could be with us.
Oh, good morning, and very good morning to all your viewers.
Tell us about this texting support program. How does it work?
So the program works by people just texting the word Hope NS to the number 393939, and they are immediately enrolled to receive daily supportive text messages, which are tailored specifically to help them address stress, anxiety, depression symptoms that are related to the ongoing wildfires and other personal stresses that they may be experiencing. Some of the text messages have embedded in them links to other resources. So you get a text message. If you are interested, you can click on the links and then you can be able to read additional resources and additional strategies to help you mitigate the stress that we are all experiencing because of the ongoing wildfires.
We mentioned that this program has already been put to use in Alberta. How do we know that it helps, that it works?
So there have been 5 or more randomized controlled trials. We conducted 2 of them in Ireland. There have been 2 additional randomized controlled trials, one in Fort McMurray, one in Grand Prairie. There's currently a big randomized controlled trial that's going on in Alberta, and we've recently initiated another one here in Nova Scotia as well. And with the 4 that we already have results for, all of which have been published in peer-reviewed scientific journals, we have evidence to the effect that the intervention helps people reduce their levels of particularly of depression, and also helps people reduce their drinking if they have a problem drinking. We also launched the Text for Hope program during the pandemic. We had over 60,000 people subscribe to the program. We gave surveys for those who sign up to complete a baseline and then a follow up at 6 weeks and 3 months. And we found significant reduction in levels of stress, anxiety, depression, suicidal ideation, and also disturbed sleep. About 85% of those who subscribed reported they felt connected to a support system, and 83% reported that the program helped to improve their overall psychological well-being.
Wow,
So,
85%. Wow.
yeah,
And you have a personal connection to this, do you not?
yeah. So I mean, I was in 2016 working in Fort McMurray when the wildfire that destroyed or devastated the city actually happened, and at the time we had just launched the Text for Mood program in January when the wildfires broke out in May. So I was part of those who were evacuated. We successfully used the Text for Mood program to provide support and information for those who were evacuated, from Fort McMurray. And so I do understand, the trauma and the stress that people are going through, and I'm quite confident this is going to be very helpful for many people who subscribe.
Yeah, and you just used a word that I wanted to ask you about specifically, and that is trauma. The idea that you would lose your home, all of your memories in really a moment, and you don't have time to prepare. How does that trauma impact people? And what are the signs of trouble, I guess, if you see or you know someone who is really struggling to cope with that enormous loss?
Yeah, so I mean, there are diverse presentations that people are going to come up with. The majority of people, when there's any traumatic event, would experience some psychological symptoms. Not all of them will progress into becoming disorders, but at least we have a large proportion of people experience what we call an acute stress disorder. And acute stress disorder, people have problems, kind of with their sleep. They become very anxious. They experience some level of hypervigilance. They have poor concentration. They become disorientated. They some experience panic attacks. Some lose their motivation to be able to participate in pleasurable activities because their attention is just focused on the loss and really thinking about really how they are going to go about with the future. So some of these will progress, persist, and get worse, and some may develop an adjustment disorder. And if it goes on for a very long time, some people may begin to experience, nightmares associated with a traumatic event, at which stage we would say that some are developing a post-traumatic stress disorder. Some may also go on to develop a major depressive disorder in which, sleep is significantly impaired, their appetite significantly impaired, concentration levels are down, they develop a loss of interest in pleasurable activities that they used to enjoy participating in. So it's really very important that people receive support that will potentially protect or mitigate potential development of these psychological problems that could potentially come about as a result of the trauma.
Doctor, thank you so much. And once again, the text for hope is 393939.
Thank you very much.
Thank you.
Thank you.